As the month of May comes to a close, the Speech and Language Therapy team of NMC Brovita International Medical Center are here with us to share some insights into the field of speech therapy, celebrating Better Speech and Hearing Awareness Month, and also Dysphagia Awareness Month for the month of June. So I have with me today 3 of the senior team. First, we have Marian Susan Raju, who is a senior SLP from Brovita Abu Dhabi, and she also specializes in swallowing disorders for the adult and pediatric population. Next, we have Sajna Sajil, who is also a senior SLP and is our primary therapist for AmeriCare, Brovita's home care wing. And finally, last but not the least, we have Ms. Pooja Sunil, who is also a senior SLP based in the outpatient department of NMC Royal Hospital here in Khalifa City A. Thank you so much, ladies, for joining me today. So let me ask the first question to Marian. It is Better Hearing and Speech Month. So what does the Better Hearing and Speech Month mean to you as a speech language pathologist?
During this month, we are trying to create awareness about hearing and communication disorders and about the possible treatment options to improve the quality of patients' life. And of course, a month to celebrate a profession globally and to appreciate the efforts done by each speech therapist in improving patients' life.
Okay, so Sajna, why do you enjoy being an SLP?
As a speech therapist, it's a versatile job and it's very dynamic and it's more of like rewarding as well. Like, for example, if you treat a patient and that patient is getting benefit from your treatment and we discharge that patient, and that smile and that happiness on that patient's face and that family, it's actually rewarding. Like, we are more happy than them. And we can work in a wide variety of setups like home care, in hospitals, in long-term care, and then we can work in school-based setups. So it's like more of like you have variety of options to work with.
What are some areas of speech therapy that you specialize in?
I'm specialized mostly in pediatric population, patients with more of communication disorders, autism spectrum disorders, or patients with feeding problems. I'm certified therapist of oral placement therapy, and I have done certified course in ABA, Behavioral Analysis Program, and then I'm specialized in AVT, Auditory Verbal Therapy. This technique we are using for patients with hearing impairment, those who are done with cochlear implant or fitted with hearing aids. And we treat patients with post-stroke, and then we have like neurological disorders, all ranges of patients we are treating there in home care.
So Pooja, what are some other domains that speech therapists specialize in?
Speech therapists work across lifespan, ranging from neonates to geriatric population. SLPs work in different settings, including outpatient clinic, school-based setting, home care setup, ICUs including neonates and adults, then rehabilitation hospitals, long-term care units as well.
That's amazing. So can you tell me more about your role in the care of the child who is just born?
So when a baby is born, especially when he or she is a premature baby or with any other medical condition, they will have issues with sucking and they will have poor suck-swallow coordination. So we will assess the readiness to feed by mouth, and we will also give suggestion to the family to select the appropriate size of bottle, like feeding bottle, the rate of flow in the nipple, and the best position to feed the baby, and the precautions to be aware while feeding, etc. And we also help the family to promote early communication skills and to identify the early signs of developmental delays.
That's interesting. I read in your profile, Marian, that you specialize in dysphagia. So what does that mean?
Dysphagia is a medical term for swallowing difficulties. It can occur at any age and it can originate anywhere in your mouth, throat or esophagus. It is usually seen in patients post-stroke, brain injury or post-head and neck cancer treatments and neurodegenerative diseases. The most symptoms people complain of feeling of food getting stuck in your throat, pain while swallowing, and history of weight loss, or coughing or gagging while eating, or change in voice quality, anything. So we as speech therapists will assess the patient's ability to swallow and determine the risk of aspiration. So depends on the findings, we will start with swallow intervention.
So Pooja, do you also treat patients with dysphagia and feeding difficulties in your outpatient clinic?
Yes, of course. We do help patients with swallow difficulties in our clinic. So when a patient is referred to the outpatient clinic, SLP will perform a clinical swallow evaluation to identify the swallow concerns, and if required, that is if we need a further confirmation regarding the diagnosis, we will proceed with the instrumental swallow evaluation, which is called as video fluoroscopy. And this is very much similar to X-ray, kind of moving X-ray. And once conducted the video fluoroscopy, we will be identifying the problems in detail. Based on the findings made by us with the initial swallow evaluation and based on video fluoroscopy, we can actually design strategies or techniques to help the patients overcome the problem. Okay. And apart from this, there is another disorder that we treat in our clinic, which is called as oral aversion. So especially in pediatric population, when we do, there are certain kids who have problem accepting various textures. So we treat this with oral placement therapy and help them overcome the problems.
Okay, so Pooja, so what are other areas of speech therapy that you specialize in the outpatient department?
We assess and treat patients with voice concerns, those who are with stuttering, adult communication disorders like dementia, aphasia, dysarthria, etc.
So Sajna, do you also see all of the patients in home care? And what is it like to conduct speech therapy at home?
Yes, we do treat all these patients in home care as well. However, some insurance they don't cover all these patients, because insurance cover only patients who are really bed bound or have difficulties in getting them to the OPD clinics. And in home care, we see patients with parents who are really busy in their work schedule and who cannot bring their kids for the OPD or hospital setups. So all these patients get benefit from home care. And in home, patients are with neurological disorders like post-stroke patients or road traffic patients who are bed bound, or it's difficult for them to transport from home to a hospital setup. All these patients we do treat in the home care as well. And as you know, there are advantages and disadvantages for this too. Advantages is patients are getting treatment in their comfort zone, in their home, natural setup. They don't have to come to a hospital setup. But the disadvantage is with pediatric patients especially. When you go there and the patients will be, if they are not in a good mood, they can roam around, they can go to their comfort zone. So in such cases, we find difficult to manage that population, to make them sit and participate in the therapy sessions.
Okay, so I've heard about many speech therapists emphasize on the importance of early identification and intervention. What does that mean, and why is it so important?
Early intervention or identifying the problem at an early age does not just mean that we are just giving treatment to the child. This also gives support, guidance and education to the family and parents. There is something called as neuroplasticity. In researches, it says that within the 3 years of life, our brain is more vulnerable in modeling. It's more moldable, yes. So it's important that early intervention should be given in each cases, and it plays an important role in your child's development. Either it could be a hearing problem, speech and language problem, or a swallowing problem. And in adult population, like after stroke or brain damage, you give the intervention at an early stage, so the outcome is better and we can see recovery faster.
Okay, so what message would you like to give to parents who may have children with delayed speech?
Yeah, of course, as a speech therapist, we would like the parents to give the message if you have any doubt, don't wait. It's never early to do an assessment. So if you think there is any delay in any aspects of their development, it's for example, maybe they're milestones or speech and language skills or swallowing, anything. If you have any concern, please don't delay an assessment, and give them more interactive time. Give them a quality family time, give them socialization skills with their peers, or in this time it's not applicable to say avoid screen time, it's not practical, but still I would like to suggest avoid it or try to reduce it maximum.
Yes, I agree with Sajna. In addition to that, especially when this pandemic started, because of the prolonged screen time and because of the lack of socialization between the peer groups, It resulted in a lot of children develop speech and language delays along with attention deficits and hyperactivity. So in this aspect, we really recommend the parents to spend quality time with the kids, getting them involved in meaningful activities, then encourage reading skills and improve socializations with the peer groups.
So tell me, are you based only in Abu Dhabi, or do you also have a team that goes to the other Emirates?
Okay, we have OPD services in NMC Royal Khalifa City, Abu Dhabi, and NMC Specialty Alain, and we have home care services in Alain, Abu Dhabi, and Dubai, and we have long-term care in Alain, Dubai, Abu Dhabi, and Sharjah.
Okay, thank you so much everyone for spending this time with me, and once again, we would like to wish everyone a very happy Better Speech and Hearing Month, and also advanced Happy Dysphagia Awareness Month. We would like to celebrate all of our dedicated, amazing speech therapists all around the world as they strive to bring out the best in the people that they serve. Thank you once again.